outcomes first emerged in this House, I used the phrase that everybody knew but nobody knew. And when you look at the documentation that was produced yesterday by the Department, those words ring very true. Because everybody knew within the National Screening Programme, within Cervical Check, senior level at the HSE, and the key officials within the Department of Health and Children. And when I met with Minister Harris at that time, with Deputy Stephen Donnelly and his officials, we got a commitment from the Minister that, notwithstanding any inquiry he would establish, that he would publish information as he got it, and that he would not seek to suppress any Dáil committee or the Dáil from considering the issues pertaining to the cervical cancer screening programme. And I was amazed last week when the three memos emerged at public accounts, because I would have thought the Minister would have summoned in his officials, demanded all of that documentation and published it in an ordered, structured way. It has taken us 3 weeks to get to the kind of documentation that we received yesterday. And I note, and I want to make it very clear, the Taoiseach was on television 6-1 last week saying he doesn't think public accounts should be the place to discuss this. Other ministers followed suit. There appears to be an agenda to try and push public accounts to one side and other Dáil committees. We got a commitment from the Minister that no attempt would be made to prevent the publication or Dáil committees doing its work in relation to this, and that the inquiry would not be used as an attempt to bury information from the public domain. We got that commitment. I think the government should adhere to it. In the documentation itself, Minister, it's very, very clear that the policy of open disclosure is very much a live issue throughout 2016. Every month they're meeting, and cervical check audit is on the agenda. These are joint meetings now between the Department of Health senior officials, Chief Medical Officer and the National Screening Service and cervical check. And they're basically saying, while cervical check supports the principles of open disclosure, it's recognised that there are limitations to its universal implementation, particularly for screening services where there is an inherent recognised error rate. Now, at the same time, the then Minister is proclaiming his commitment to introduce mandatory open disclosure. And I'm wondering, Minister, if you could give a commitment to publish all the advices that the then Minister received from the Chief Medical Officer in relation to the policy of mandatory open disclosure. Is there any link between what's going on here with all of these senior officials, with senior officials in the HSE and cervical check are openly saying, actually, we need an exemption here from open disclosure in relation to this screening programme? Is that filtering across to the wider policy of essentially going against what the Minister who originally had proclaimed publicly, i.e. I'm going to introduce mandatory reporting? That got subsequently changed in policy terms. What was the reason for that? Can you give a commitment to publish those advices in relation to the Balfassa in terms of open disclosure? I'm simply making 2 quick points. First of all, the Taoiseach makes his statement that public accounts shouldn't be involved in this, followed by other ministers. There was a meeting of the Committee of Procedure and Privileges last evening to discuss whether they should or not. Minister or Deputy Harty, as Chair of the Health Committee, writes to say, I don't think they should. No, I'm not saying any of this is connected. I'm not joining any dots. But it looks like, from looking from the outside, I've never interfered with public accounts as a party leader. I've never given any guidance or instructions to anybody. It's very important that the government doesn't attempt to try and muzzle a key committee of this House. Whether you agree with what they do, how they do it, it's beside the point. It's a parliamentary committee, and Dr. Scally as well has indicated that the fevered atmosphere and so on. So let's be very clear on that. That is why I'm raising this now in a plenary session of the House, to say that, because we wouldn't have seen those documents last week if it wasn't for public accounts. And you said the Minister was being committed. He said this 3 weeks ago, and we didn't get it. I find it inexplicable as to why people didn't front up at that early stage and say, here's all the documentation. Second point is simply on open disclosure. What's very interesting in this documentation is really an attempt to exempt the cervical screening programme from the strict rigours of open disclosure.
Thank you, Deputy.
And if you look at the letters, the templates for letters to the women concerned, they're giving the consultants a way out. The language is "you may." And so clearly there's a circumvention of open disclosure going on for whatever reason. And is there any link between that and the decision of the then Minister Leo Varadkar not to proceed with his original commitment to introduce mandatory open disclosure. It's an interesting point from a policy perspective. A lot of people are making decisions without ministers knowing, and equally
Deputy,
on substantive issues of policy, that seems to be the case also.
Minister.